All right, so for this section of our PowerPoint or lecture, I want you to ask yourself these questions when we finish. Can you identify 3 diagnostic criteria? Can you list 5 physical effects of anorexia nervosa? So what happens to your body? And then on number 3, can you describe some of the techniques and therapies that we use in order to treat anorexia nervosa? Okay, so this slide answers that very first objective, and that is that diagnostic criteria for anorexia nervosa. So, someone with this disorder eating, they will have extreme restriction. So, they're going to eat very, very little, not enough in order to maintain their body weight. And B, they're going to have overwhelming distress about weight gain. A fear is what is usually said, a fear of weight gain. And this is different from what we'll see later on in a different eating disorder. And in C, we're going to see a disturbed perception, meaning that what they see in the mirror is not actual. And in fact, in previous clinical experience, we would put someone against the wall and we would outline and draw their figure and let them step out and actually see what their body is, because in the mirror they don't see that, but drawing and tracing around their body kind of gives them an idea of what their body actually is. They can actually feel you tracing them, and can step out and see that image without their face being in it. All right, so here are some of the most common behaviors that someone may exhibit when they have anorexia nervosa. Of course, they eat very, very little food. They have a short list of safe foods, meaning they might say that they have an allergy to gluten, or that they dislike a certain type of food because they feel like it's unhealthy. So it could be preservatives or something that would help them to justify to somebody else why they're not eating a lot of that particular food. In fact, I've actually been asked this at a hospital from an auditor, as if someone had a long list of allergies and foods that they were unable to eat for whatever reason. What is something else that I would make sure that I screen that patient for? Are they hiding or storing food, meaning that they're maybe moving food underneath uh, something else to hide it, that they actually, it looks like that they did eat that food? Are they preparing meals for others but themselves are not eating? Maybe they say, oh, I already ate, or I'm just too full right now, I don't feel good. Do they have a drive for perfection? This is that OCD factor here that I say is commonly, in my own experience, linked to anorexia nervosa. Compensatory behaviors. This is getting rid. Purging is not always vomiting, but it also could be any type of way that someone uses or develops in order to get rid of the calories that were consumed. So laxatives, diuretics, I mean, that's really going to pull off water and minerals, and then excessive exercise. So going in and making sure that they are exercising after they do eat a regular meal. Frequent weighing, being critical of themselves, and withdrawing from family and friends, mostly because when we're out together with family and friends, we are eating, and that's very uncomfortable with someone with anorexia nervosa. All right, I would like to give you some common characteristics, maybe signs or symptoms that you may see with someone that does have an eating disorder. Now, remember, these are general signs. Someone could have one, someone could have all of them, some could be very good at hiding things and you might not see them. All right, but these are could be signs, it could be effects from having an eating disorder. All right, so low body temperature, we're going to look at this anorexia nervosa first. So low body temperature, and this is going to be primarily due to a lower fat mass on them, and fat, remember, is very insulating, so you're going to have less to be able to hold in that body temperature. Bruising, and bruising has to deal with lower different types of vitamins that affect bruising, like vitamin K, vitamin E. Low metabolic rate, that could also impact your cold intolerance. Hair loss, fainting, fatigue, loss of heart tissue. Lanugo. Lanugo here is this very fine downy hair, and we all have it when we are in our mother's womb, and we don't really know why we have it, but we just hypothesize that maybe it could be to try to control body temperature. And so this could, if it is true, also be one of the reasons why it comes back up when someone is really losing a lot of their body fat masses to try to help to warm that core temperature. Maybe, maybe not. But lanugo, you will see with people with eating disorders, you see it more on the face area. You could see it a little bit on the arms. Um, Amenorrhea, and that is the absence of one's menstrual cycle. So remember that fat mass is also linked to hormone production, and so when you begin to lose that fat mass, you lose the ability for your body to be able to produce the hormones that you need in order to have a normal menstrual cycle. Low bone mass. This is a consequence, and as I described earlier with some of the gymnasts that you see, especially if that eating disorder is developed early on in life between the ages of 9 and 30. Muscle tears, fractures, all has to do with not having that protein in order to continue having and to stabilize a good muscle mass. All right, and then I'm going to skip over here to bulimia nervosa. Swollen salivary glands. That is because of the constant force of vomiting or purging, irritation of the esophagus, and that typically will lead to acid reflux, gastroesophageal reflux disease. It could lead to a hiatal hernia. It could lead to a lot of irritation just because of that persistent acid that is in that esophagus where it shouldn't be all the time, and stomach ulcers as well. And then in the middle, you see that is common effects between both of these disorders, at least these two here. Iron deficiency anemia, blood potassium imbalance, irregular heart rate, dental decay, and constipation. I'm going to circle this dental decay here, and I will say that many times our dentists are one of the first to actually observe that someone may have bulimia nervosa, because at the very back of your teeth, when acid is constantly kind of back at that mouth, then you will get these little pits in the teeth, and that leads to well, it can lead to a cavity, but it also leads to this distinct signal that someone may have some issues with frequent purging. Constipation is because of low amounts of food, but also low amounts of water in the body. I will also say that's not listed here. If you're looking for a sign, is that someone who has bulimia, who is doing self-induced purging or vomiting, may actually have some calluses here on their knuckles. It could be up here or down from just actually sticking their fingers down their throat at the initiation of their eating disorder. However, later on, someone who has really had bulimia nervosa for a long time, they no longer have to actually initiate kind of the gagging reflex. They can just kind of bend over, and they've done it so long, their body has a natural reflex of being able to induce emesis or vomiting. Um, Sleep disturbances, immune dysfunction, and infertility. These are all common amongst anyone who's, well, I'll say infertility especially, is common amongst anyone who has a under or suboptimal amount of body fat or excessive amount of body fat, because fat related to hormones, too little, too much, affects your ability as a woman to be able to menstruate, and therefore affects your fertility. And then the last one being binge eating disorder. And remember, this is just the three most common types of eating disorders. Someone with a binge eating disorder is more likely to have obesity-related diseases like hypertension, type 2 diabetes, hyperlipidemia, which is high cholesterol, high triglycerides, a fatty liver that is a non-alcoholic fatty liver, atherosclerosis, that's hardening of the arteries, and then different types of cancers that are more prominent amongst people with fat around their abdominal area. And then sleep apnea is that difficulty to breathe once you're laying down because you have that extra body weight compressing your respiratory system. So these are the most common physical effects of eating disorders. Remember, there are a lot more than just physical. We have a lot of mental and psychological issues that are going on here. All right, so just continuing on some of the physical effects of eating disorders, we have first up the physical effects specific to anorexia nervosa. Because of the extreme amount of calorie deprivation, you have a lot of the tissues with all in your body that have to give up their structure in order to keep the energy that's supplied for keeping your heart beating and your lungs breathing, your mind thinking. So because that muscle has to break down, that's going to affect your heart. So you have loss of heart tissue, you have changes also within your blood levels, and because your body needs within the blood certain amounts and concentrations of electrolytes, uh, you can have electrolyte shifts, which is one of the most common reasons for death within anorexia nervosa is a shift in electrolytes, usually potassium, and it has happened from students here on that we have had on Baylor campus. We have had some that are fine one day, and then the next day those electrolytes shift. They do it very quickly, and that potassium changes, goes up too high, and unfortunately it causes cardiac arrest. Also, an impaired red blood cell health, leading to, because of anemia, leading to fatigue, weakness, and fainting. Affects the nervous system, changes in your brain size. Again, all tissues are going to be affected. Immune system, your endocrine system, and also your sex hormones, which we discussed with the fertility. Continue on, we have the digestive system. You're going to have a slower digestive system, which is one of the reasons why you have constipation. You have impaired swallowing. You're going to have reflux. Muscular system, weakness, more likely to have injuries because of the deteriorated muscles. Skeletal system, loss of muscle mass is going to also impact also your risk of osteoporosis or osteopenia. Enamel erosion, which is more prominent with bulimia nervosa, but because you need calcium, you need phosphorus, etc., for good enamel production, you can also have a lot more dental caries. Integumentary system, this is the loss of subcutaneous fat. It can also affect your skin. It's going to both combined affect your ability to be able to insulate yourself and also regulate your body temperature. Okay, because I have already gone over the reasoning why a woman would lose her fertility or decrease her fertility and also her menstrual cycle. I'm not going to go and read over this slide again, but it's a good one. I'm going to keep it in here within your slides stack in order to go back and reference it, such so that you understand the actual requirement for body fat and for calories in order to have that regular menstrual cycle. Right, in 2010, the death of French fashion model Isabelle Caro increased awareness of the serious nature of anorexia nervosa. So she actually ended up having a coma from her eating disorder, or anorexia, and she was able to overcome it and speak out against the dieting fashion in the industry. This made a really big, at least an initiation of or start to change. She posed for a controversial billboard ad under the words "No anorexia." Unfortunately, her anorexia did not improve enough in order to save her life, and she ended up dying from these complications at the age of 28. All right, so as I mentioned earlier, we're going to look at some of the treatments that are for eating disorders, and this one first revolving around anorexia nervosa. Now, remember, um, treatment is ongoing, it's consistent, it's kind of like alcoholism. You're never really kind of said to be cured from your disorder, but it's ongoing, but you can improve and definitely be able to cope with it the rest of your life. But people with eating disorders, they definitely need an intervention from a multidisciplinary team, which is what I'm kind of highlighting here. And it says physician, registered dietitian, and also psychologist, psychiatrist, psychologist, nurse, and also a social worker. And I always like to say, even though I like, of course, as being a registered dietitian, I would love to be first. I want to always recommend that my services are last because you have to treat the etiology before you can really focus on nutrition. And if the etiology is psychological, then we need to make sure that that is what is treated first. The physician being first because we need to make sure that person is stable enough to even start treatment. Then I ask for the psychological treatment by either counselors or trained psychiatrists, psychologists within that field. And even recommend that if someone does have an eating disorder and they get to the period where they are ready to speak with a registered dietitian, that they are actually seeking guidance from a registered dietitian who has an additional certification in treating eating disorders. There are many different clinics. Unfortunately, we don't have a lot of options here in Waco. We only have about one, but most of them are residing in larger cities, which makes it really difficult to treat those who are in more rural areas. Typically, someone will start out in the outpatient availability first, and if it's not able to be handled in that situation, they may be hospitalized, especially if they are about 75% less than what they should be at for themselves. Insurance may cover treatments, it may not. That's another reason why it's very difficult to treat a lot of eating disorders, is because financially it's expensive to see some of these specialists. All right, so here's our goal for nutrition therapy. We want to make sure that we can first reverse our weight loss trend and then hopefully maintain weight and then restore that body weight until it gets to a healthy range in order to support just basic health. We want to make sure that before we even start talking about diet, that we gain their cooperation and trust, and we increase their food intake in order to meet their basal metabolic needs. We prevent any further weight loss, and a goal of only, and this is a really high goal in my opinion, 2 to 3 pounds per week. Usually that's a half a pound to a pound and a half to be realistic. Restore appropriate food habits. Appropriate meaning just a balanced diet. Not trying to even work on macros or anything, but hey, let's have a my plate and have kind of the fruits, vegetables, grains, and protein. Reduce the restriction and then ultimately achieve that healthy weight and emphasize on some of those nutrients that are really important in order to maintain growth and just your overall basic functional needs. Unfortunately, a lot of medications are not generally effective for eating disorders. However, a lot of, I would say, anorexia nervosa, and also I would say, well, no, I would say anorexia and bulimia and also binge eating disorder oftentimes are prescribed a lot of medications that deal with anxiety and depression because we want to be able to control some of those compounding factors that can make some level of anxiety increase. So if we can control that, we can help increase the likelihood of being able to at least continue on with therapy and recover. All right, look at the recovery rates down here. We have 1/3 of those with eating disorders will recover within 4 years, and one half, 50%, will recover in 10 years. You can see this is a very long and ongoing type of disease to try to treat. Okay, some concepts that I wish you to know by the time we finish this part of the lecture is that I want you to be able to tell me what type of characteristics are related to bulimia nervosa, and then what would be the main triggers related to bulimia. What is a compensatory behavior? What is that? Is it vomiting? Is it some other different behaviors as we discussed a little bit earlier with anorexia? And then be able to describe at least 3 physical effects or a consequence of bulimia, and then outline some of the basic components of therapy and treatment for bulimia nervosa. So, bulimia nervosa is defined as recurrent episodes of binge eating followed by compensatory behavior. And this is all in order to prevent weight gain. Now, we have 2 disorders on here. We have bulimia, and then we also have binge eating. They did put nervosa up here, but because bulimia can, well, not necessarily, they really should have put nervosa. But binge eating is consuming an abnormally large amount of food within a short period of time. So abnormally large, highlight that one. And then within a short period of time, it says 30 minutes to 2 hours. And that is because that is the normal time that food takes to digest within your stomach. Compensatory behaviors are purging. These are actions that your body or that you actively take in order to get rid of that extra food or extra calories. And usually this is because of this extreme amount of guilt, and this is felt kind of throughout the body. It's almost can think about it as a hot flash that kind of exuberates your whole body. And then these types of behaviors can include vomiting, laxatives, and then also excessive amounts of exercise. It's very likely with this disease that many people continue to live undiagnosed with this because this is a behavior that is very kind of even more so felt with with shame and guilt compared to some of the other types of eating disorders because of the use of purging. All right, so here's some, if we're going to look at the DSM-5, that is that official diagnostic criteria in order to be able to report it and to also receive treatment when it comes to your physicians. A, repeated binge eating, so eating large amounts of food, usually within 2 hours, and then experiencing a sensation or feeling of a loss of control during that period of binge eating. And then also to compensate. So I will say this does not have to be in every single day, every single meal time, but needs to be at least one time per week for at least 3 months because a disease is chronic and it's not going to be acute. So this is a chronic disease, so it needs to be 3 months or longer to officially receive this diagnosis. Does not mean that that person that's living with it for 2 months does not need to receive treatment. They just typically will not get that official diagnosis until then. Undue influence of body weight or shape on evaluation, and it means that they are very concerned about their weight. And the behaviors that are distinct from binge eating itself or purge eating itself and anorexia nervosa, because remember, anorexia can have some of the same types of characteristics when it comes to purging or excessive exercise. But you're definitely going to see both purging of some sort plus excessive eating with a feeling of loss of control, and this is due to kind of that concern for maintaining a certain type of physical appearance. All right, some of the most common behaviors of bulimia nervosa in continuance here we have hidden binge and purge habits. These are not always going to be very obvious. You can look for things like you can look for laxative wrappers. You could see hidden stores of food within their rooms or underneath their bed, because a lot of times the binging is not going to be in front of their friends and family. It's going to be at home in their room or away from others. Their binge may consist of just itself, within that 2 hours, over 3,000 calories itself. It's usually going to be on carbohydrate types of foods. I will tell you this is because of either the fact that those are those most desirable foods, but also because they don't hurt as bad when they are purged or when you vomit with these. You're not going to pick things that are very jagged like chips and salsa. Spicy things are going to burn even more throughout your esophagus when you do purge. Remember that purging can be vomiting, can be laxatives, all of this in efforts to avoid excessive weight gain. About 70 or maybe up to 75% of the calories that you take in are actually absorbed. So this is one of the one of the reasons why it's difficult to diagnose is that many people with bulimia nervosa may not be underweight. They may be at a what would appear a normal weight. They could even be a little bit overweight. They sometimes, but more rarely, are underweight. So, and that's because you are actually absorbing some of those calories, just depending upon that individual. Some individuals actually have a combination of bulimia nervosa and anorexia nervosa, and so they could be underweight. Excessive exercise is also used when people are unable to purge, or maybe they either are physically unable to make themselves vomit, or maybe they are in an environment where they don't feel like it's as private, and they will then use physical exercise in order to purge those calories. And this textbook does a great job of actually giving an image of one of the signs of bulimia nervosa, and it's known as Russell signs. It's these abrasions or calluses that you can identify on knuckles from when they actually scrape your teeth as you try to induce vomiting or gag reflex. Um, this is usually, again, on those who are new to bulimia nervosa, but does not happen on everyone because I've seen many clients use other types of objects, like even a toothbrush that has occurred with this in order to induce vomiting and hide these types of signs and symptoms. Another symptom is to be, or they have tried multiple weight loss reduction diets or fads in the past, impulsive behaviors. All of these tend to be kind of very ups and downs or cycle behaviors or patterns. Right. So a few more signs of bulimia nervosa, or some of the physical consequences or effects of it, is blood vessels. So within your eyes, if you've ever seen a busted blood vessel, you'll probably recognize that, and it doesn't necessarily mean that that person has an eating disorder, but it frequently, if someone has them over and over and over, especially if they tend to have other characteristics, this is something that I would look for. A demineral, and that is because of the strain of vomiting. If you've ever had foodborne illness, you probably have experienced a busted blood vessel before as well. So this someone who is purging quite frequently would have them more often. And then demineralization of teeth. This is has to do with, and you don't see it here with the pitting of some of the back teeth, but you do see the demineralization here within the teeth. Some of this is the loss of that tooth enamel. The drop in blood potassium, this can also occur with binge eating disorder, bulimia nervosa and anorexia nervosa. Swelling of the salivary glands, so they'll often complain of a sore throat. And they don't show it here, but if you ever looked in the back of your throat when you have strep, you probably see these little dots on the back. And this person who has this but yet does not have strep will frequently has some of those similar dots, and that's just from the irritation of the acid in contact with the back of the mouth. Stomach ulcers, bleeding, and constipation, which we also discussed earlier. So on this slide, you see some of the very common nutrition therapies that are used for treating someone with bulimia nervosa. First being that we correct misconceptions about food, that there are not necessarily a good food, bad food, healthy food, unhealthy food, but food can have many other characteristics that even something that someone would consider bad is actually okay. Remember that eating something one time is never going to affect someone's health. It's the longevity of diet that really counts. Establishing some good and normal eating patterns. This is what's known as good as gentle nutrition. We're not putting anyone on a very strict diet and forcing someone, but very kind of slowly unraveling some of those misconceptions about what is considered to be a healthy diet. We want to decrease the frequency of purging. We won't necessarily stop it at the beginning, but slowly get them on a journey to return to a normal, healthy eating pattern. Some of the psychological therapies, we want to improve self-acceptance, really treat psychologically what it is about that person that they dislike and that they are actually trying to control. Is it actually their physical appearance, or is it something else in their life? Change that all or none attitude. A lot of people have this misconception that health is something that you are all in or none, and that's not actually what is required for good health. Group therapy is very beneficial, especially amongst our adolescents. And you're seeing the same type of drug, and this is not the only one. It's the only one that is approved by FDA. It does not necessarily mean it's the only one that's effective, but Prozac is used as an antidepressant to help to control some of the anxiety and depression that's related to eating disorders.